My name is Bev Smith, and I'm the Executive Director of Kidsports, and I just want to thank you for being a part of the Kidsports team. We look to use all of the incredible community resources that we have in Eugene and Springfield, and one of those is Slocum Orthopedics. We have them as a resource to help you navigate some of those injuries and some of those bumps in the roads that are bound to happen when you play any kind of sport or activity.
We see over 275,000 patient visits a year, and many of those visits are related to injuries that are preventable. Kidsports and Slocum working together is just a great partnership for Slocum to get the word out on how to avoid injuries when you're playing sports.
Most common wrist injuries that we see in youth sports is a sprain, and that's typically from falling out onto an outstretched wrist. Most kids with a sprained wrist will have swelling and pain, but no bruising. And they'll have pretty good mobility of the wrist. As long as there's just simple swelling and good mobility, you can easily buy an over-the-counter brace and rest for a week or so until the mobility improves and they can use their wrist better without pain. But if you see a lot of swelling and bruising, you should probably see someone for an x-ray. I tell parents if they can't do a push-up off the floor without pain, they're probably not ready to get back into the sport. When they break their wrist, it can be a little bit of a longer recovery. When we see growth plate injuries, we're usually in a cast for about 4 weeks and returning to sport somewhere around 5 to 6 weeks.
Sever's disease is a condition where kids will develop heel pain. In boys, we tend to see it around 11 and 12. Girls, we tend to see it around 9 and 10. Tend to see it in the sports that involve a lot of running. The key thing with it, though, is it's not serious. It causes pain. They can flare it up with activity, but it is not going to cause any long-term problems whatsoever. It is a direct result of the combination of growth and activity. Management is we're going to deal with it and try and lessen the pain and lessen the chances of it flaring up, and it's just going to go away over time, because what's going to solve it eventually is growth. As soon as that bone is done growing, that problem is solved. So the management involves ice, anti-inflammatories, and even some rest. So what we would call activity modification. You don't need to take, a week off from doing activity, but you may need to do a little bit, half of a practice or take a day or two off. And then the big part is stretching. So really wanting to stretch out those calf muscles and giving plenty of time for stretching. I usually encourage the families to have the kids stretch at least once or twice a day. Not all kids get it. We don't really understand why. There doesn't seem to be a pattern for who's going to be more prone to it, so there's not a great prevention tool for it. When it happens, it happens. We manage it, and again, there's no long-term ramifications from it.
Ligaments in knees is the soft tissue support of the joint. One of the most important things as a parent or somebody that's been injured is to think about, I got injured, what does my knee feel like? What does it look like? Am I swelling? Rapid swelling after a knee injury is a very important sign that your knee needs to be looked at right away. I think as a parent, if your child injures their knee, I would have them take a break from whatever they're doing. So I wouldn't have them go back in and play sports immediately and watch them. When a child starts walking normally, when they're worried about something else, that's a good sign their knee's going to be okay. When they cannot be distracted, when they are focused solely on their knee and several hours have passed and they are still talking about their knee, that's a worrisome sign. When you first have a knee injury, there's some very helpful things to consider. One is the acronym RICE, which you may be familiar with. Rest, so you're gonna stop whatever you're doing at that moment. Ice, some cold compress on there to help with swelling. Compression, so you'll wrap the knee with an ACE wrap. And elevation, getting that knee above the level of your chest to help with the swelling. One of the best things you can do to prevent a knee ligament injury is year-round conditioning. A cross-trained, physically conditioned athlete is the least vulnerable person, so you want to be that person.
The good news is the vast majority of ankle sprains get better just with time. When somebody sprains their ankle, the most common way it's sprained is with an inversion type injury where the foot rotates, in relative to the rest of the leg. Common, symptoms after that would be pain along the outside of the ankle, swelling at the outside of the ankle, bruising most commonly on the outside of the ankle. Initially it wouldn't be uncommon for, an athlete to have trouble putting weight on the ankle. If an injury
is severe enough to where you're not able to put weight on it after 2 or 3 days, then it warrants an x-ray. Return to sport after an ankle sprain or really any injury is just having near normal strength when compared to the other side. So I think one of the things that we're trying to prevent with getting somebody back to sport is to prevent another injury if they're, still recovering from their previous injury and aren't quite ready to go back.
Thank you for taking part in this video series. We hope it's been very helpful, and I think it reflects how much we care about your child's experience here in our youth sport programs and how much we will use community resources like Slocum to provide your child with a wonderful, warm, safe, and exciting season of sport. Thank you.